Well, hello, hashtag treadmillers. I'm out on a bit of a muddy, steep hill hike today, enjoying this, what is today, Wednesday afternoon. Still a little bit of snow lingering around from this morning's flurries, but for the most part, the sun's out, and it's a nice day where I'm at. I hope so with you. I post a lot to social media, whether it's through my videos or my blog or articles I write for some other blogs. I wrote an article this morning for the Canadian Massage Association, I guess it is, magazine that'll be coming out soon, talking about mastery, the concept of mastery, and is it something we really want to be shooting for? I know that some of the things that I speak about aren't always the most popular because it seems like I'm discrediting what people know and what people learn and what people teach, and but certainly it's not my intent, but I know it comes out that way, and if that's the way people take it, so be it. But I do think there's value in being challenged. I know that as a professional, I've been challenged a lot of my life in terms of people questioning what I do, what I believe, who I train with, all those things. And you know what? 15, 20 years ago, if you had started to, or tried to tell me that what I believed about fascia and myofascial release and things like that were not accurate or were not scientifically proven, I would have either not listened to you, or we would have started a bit of a word of words. And one of my favorite or famous word of words is Forever Emboldened on somasimple.com. And you know what? You got to take somebody when they're ready, and whether it's a therapist coming to take a seminar or looking for a bit of different advice, different take on things, or whether it's a patient coming to us. I still get patients to this day coming to me and saying, you know what, my fascia's all bound down. And one of the worst things I think I can do is immediately try and tell them they're wrong. Okay. I do think there's value in allowing somebody their beliefs to a certain point. If something that they believe, and whether it's their fascia or other things about their core or weakness or whatever, if some of those things start to get in the way of their progress, then over time we're going to have a conversation. But you know what? You got to hit everybody in stride. You got to hit everybody in their time when they're ready to accept it. And I figure people who show up at my seminar, 95% of the people are there because they know what I stand for. They know what I don't stand for, and it's their time, right? And when it's your time, maybe it'll be time to listen. Do I have all the answers? Absolutely not. In fact, I love almost relishing in the uncertainty of what it is that we know and don't know. I mean, I know enough to know that I don't know everything. I know enough to, I better be careful on this one here. It's getting a little steep and a little muddy. If I go down, I'll catch you on the other side. I know enough to know that I don't know everything. But what's an interesting take on things is if you're talking to somebody and you notice that they basically were taught completely different ideas than you were, be it the tissue model or the pathology model. Why is it that if both of you have, quote unquote, the answer, why is it that you can both help somebody and really help somebody in a meaningful way? Up to now, I've not read a study that says X modality is the greatest modality in the history of healthcare, even though there's some people who claim that. They all can be useful. What are some of those common factors? I don't think it's necessarily the things that we do with our hands. I think it's the relationship that we build with each other and with our patients. And that's kind of the way I look at manual therapy. It's a tool to connect with them in a way that they found useful and meaningful. And my goal is to help you start moving easier, maybe with less pain, maybe with less difficulty, etc. And I do think that the engagement itself, that the interaction between us probably has more meaning than the things we think we're doing with the tissues. So, well, enough for now. I got to pay attention to what I'm doing because trail's getting a little steeper, a little muddier, and I don't want to go down. Talk to you next time.